Hi, I'm going to demonstrate the intramuscular injection. I have all my supplies in front of me. I have the medication, the alcohol wipe, a needle. It would be a 23 to 25 gauge needle, about 1 inch. I don't actually have a needle, but this is what we're going to use. And then a syringe size, depending on how much you're going to draw up from the vaccine, multi-dose vaccine vial. And I have my hand sanitizer. So do some hand hygiene first. And then you want to ensure that you have the right medication, so the right vaccine. If you're giving, so for this instance, you're giving the COVID vaccine, it would be, okay, this is the COVID vaccine, it's Moderna or Pfizer. You're also going to check the time. You want to ensure that the expiration is, it's not expired, and then the lot number. And then you would pop the cap. You have the multi-dose vial. Okay. And then you're going to scrub the hub of the vial for about 10 seconds. All right, and then just let it sit there to dry. Okay, and then we're going to open up our syringe and needle. So here's our syringe. Here's our needle. Okay. So the cap has dried, so we're able to draw up now medication. We should know exactly how much the dose of the vaccine that we want to get. So for instance, it would be 0.3 milliliters. So this is a 12 milliliter syringe. We would want to get 0.3. This is not the right size syringe you'd want to get. You'd want to get a smaller one, but it's just a demonstration. So flip it, and then it'll draw back. You want to ensure that you have no air bubbles. Okay. And that you have the right amount. Okay, perfect. And then if you do have any air bubbles in the syringe, you're able to squirt it out, push it out from the top. In this instance, I do not have any air bubbles, if you can see it. But you do not want to waste any of the vaccine, so you would just push it a little bit out if you did. And then, because it's an unused needle, it's still new, you could recap it. You just want to be extra careful. And then when you get to the patient, you want to ensure, of course, you do hand hygiene again. Identify the patient, so if they have a name tag or an ID, you would get their name, their date of birth, so you have 2 patient identifiers. You want to ensure that you have the right medication, which is the vaccine that we're giving, the right dose, so how much you have, the right time. You want to ensure, of course, that it's not expired, or that if this is the first vaccine, okay, so it's not that they're having a repeated vaccine or etc. You want to ensure it's the right time to give this medication, basically. The right reason, you're getting a vaccine, so you'd hopefully develop the antibodies to fight the infection. And then you want to do a right assessment, pre-assessment. So do you have any allergies, sir? They would hopefully say no. Have you ever had a flu shot in the past and had any allergies from it? Do you have any allergies to egg products, eggshells? No. And then we would want to, of course, ensure that we're able to give them the medication. So we're all set. Did hand hygiene, put on my gloves. So if we're giving an IM injection, we'd most likely do it in the acromion process, or for the deltoid muscle near the closer to the acromion process. So for this one, we would roll up their sleeve. You could see their acromion process, and then 2 inches down, we would do like a little V shape with their hand, and we could see the deltoid muscle really well. You want them to relax their muscle so it's not up like in this position, so it's like flexing. So he has it relaxed, it's on his side. We'll use an alcohol swab to vigorously swab the area for about 10 to 20 seconds, and then we would let that dry. And then we would grab our medication. We'd let the patient, hey, if you could just turn to the side, we're going to give you the medication now. We could uncap the medication, put it in at a 90-degree angle so you make sure that you're in the muscle, and then squeeze. And then you can pull it straight out, let go, and then most syringes, they have like a mechanism where you could just rub it against a table, the edge of it or something, and it recaps itself. This instance, it's not a syringe, so I don't have that mechanism. And then we want to immediately put it in the sharps container. We would also have a Band-Aid. I don't have a Band-Aid in this situation, but we'd put a Band-Aid over the spot that we injected him in, and then you're all set, sir. We're gonna just document that you had the vaccine, and then you're all set to whatever, go home if you need to. And then just discard our gloves in the trash, and we're all set.